2, 1, recording. Good morning, friends. It's a great pleasure to introduce our next speaker, the young, dynamic orthopedic surgeon from Rome, Italy, my very close friend, Mario Tangari. He comes from the land of Pythagoras and he comes from the land of Archimedes with mathematical, biological, and metaphysical mind in orthopedics, which has led to the discovery of a fantastic principle of minimally invasive fracture management, which is a mixture of intramedullary and extramedullary implants, which is a mixture of dynamism, no incisions, no plates, allows micromotion, facilitates Wolff's law, helps Sarmento principles, and is very useful for all developing countries which do not want to follow blindly the AO methods. Mario Tangari is well versed in Italian and he has given me the responsibility of delivering the talk in English. He will now give an introduction in English and he will be with us throughout the talk. Mario, please.
Welcome everybody. I am Mario Tangari. I am an orthopedic surgeon in Italy, in Rome. I am an inventor in MIROS philosophy and MIROS medical device with application of my system in many fracture, in epiphyseal fracture, in osteoporotic fracture in the old patients. I patented these techniques. Also, the medical device I patented nel 2004. In 2004 I patented the European patent of the clip, fondamentali, but my study is in old time. Prima, scusate, del 2000. The MIROS is philosophy, is approach in the fracture with minimally invasive approach because it's necessary to patients don't apportare the new morbidity with surgeon intervento chirurgico. Sorry for my English. The MIROS, the concept of the MIROS is the use of wires and instruments opportunity preformed and the clips. But the MIROS is the reduction of fracture with MIROS is internal reduction of the fracture. With MIROS you perform many combination of the possibility of combination of the synthesis with the internal, external, hybrid synthesis for the a new original synthesis. The name is delta synthesis. With this system you use for restore the fracture in original restore with you restore the arc. My concept is the anatomic of extremity is the arc. The arc at Leonardo da Vinci. See, the arc is an construction very strong, but che nasce da due debolezze. In italiano dice Leonardo da Vinci. L'arco è una costruzione che nasce da due debolezze, ma è una costruzione molto resistente. The bone is the arc. The extremity of the bone is the arc. Do you have two arc? Arc a tutto sesto, un arco acuto, and the arc in the shoulder of esempio, in the shoulder they are the arc the arc praticamente a tutto sesto. So this philosophy, the philosophy of MIROS, with a new use with the clip, I performed with Professor Prakash, this TPTS clip. Do you have the possibility to disfruttare praticamente the wires, the arc? With the deduction is perfect. Do you have the deduction? Do you have the concept biomeccanico, the elasticity, the reduction? Okay.
So here we have a very short talk on the philosophy of MIROS. Thank you very much. 1 minute, 1 minute, 1 minute, 1 minute, 1 minute. Let's get back to this. Stop share. Let's escape. There we go. 1 minute. Share screen. Share. One momento. Here we go. So, for this talk, we are going to give a very short talk on the philosophy of the MIROS system, which Mario just explained. This talk is about the invention by Mario Tangari. His Italian talk has been converted by me into English. It's a combination of retro and metro, can be used in big cities and small cities. He is Dr. Mario Tangari, my very close friend from Italy, and his philosophy is very simple. It is not the instruments, it's not the wires, it is not the clamps. It is a philosophy which is a new and revolutionary philosophy in orthopedics. The MIROS system consists of 3 units: primary unit, secondary unit, and tertiary units. Primary unit are the special K wires, which are flexible and elastic. The secondary units are the Tangari clamps that go on the patient and attach to the wires. Tertiary units are the instruments, the spindle to drive the wire, cutters, bolts, benders, and the accessories. The wire are available in 4 diameters: 1.5 millimeters, 2 millimeters, 2.5 millimeters, and 3 millimeters. And the clamps will snap on with the wires. The wires have been tested to have a high yield strength and maximum shear resistance in the laboratory. And these wires are not the normal K wires, normal Krishna wires, or the Elizarov wires. These are the special Tangari wires made especially flexible and stable. Smaller wires are used with smaller clamps. Larger wires are used for larger clamps. And each clamp size, whether it is MIROS or TPTS, so long as they use the philosophy, uses the same dimensions of wires: 1.5 to 2.5 and 3 millimeters. 2 pairs of wires can be anchored in any direction, meaning we can rotate them to any angle to ensure a stability of the fracture in both the axes, AP and lateral. The clamp has a very specific design to accurately and firmly grasp the wire, and they are made in a combination of aluminum and titanium so that they are light yet strong. 3 different types of tests were conducted: pull-out strength, torsion stress, and tear-off strength. And it was found that these clamps have 1600% the pull-out strength of Jess or Joshi clamps, 1400% pull-out of AO and Unix clamps, and 600% pull-out strength of Elizarov cannulated bolts. The system has been tested in the laboratory and the data is available. The special instrument for surgery include the Tangari spindle, the wire bender, the clamp tightener, and the spanners. And these are not very special instruments. The main instrument is a spindle, which we can use with the available instrumentation. The clamps and wires are the most important. The same tool is used to stretch the wire and elastically bend the wires. And power tools are not used for surgery because we are performing it gently. And the purpose is to ensure that we get a proper intra and extramedullary fixation. The most important step is to clamp the wire properly in the spindle and bend the wires to negotiate them right into the medulla. It is important to advance the wires to the opposite end of the medulla so that the entire intramedullary length is buttressed by the wire. You can see that in this way, MIROS is significantly different from external internal fixation. In conventional external fixations, the pins are perpendicular to the bone, right angle to the bone, whereas in MIROS, the wires come out flexibly and bend to accept the clamps in the right direction. In conventional fixators, a rod is used as an exoskeleton, a heavy bulky rod, whereas in MIROS, the wires themselves, as flexible as they were before, are used as the exoskeleton. MIROS is a percutaneous, closed procedure compared to plates, so far superior to plates, no scar, no incision, and no cuts. This was designed to adapt to the morphology of each anatomical district regardless of the size and also take advantage of potential of intramedullary and extramedullary fixation. The biomechanics look complicated but are rather simple. One is a linear or vertical intramedullary wire passed from metaphysis to diaphysis, perpendicular or oblique wires, horizontal wires that cross the fracture sites of the cortical area, and linear intramedullary wires diverge in the medullary cavity. I'm thankful to Dr. Mario, despite having a busy clinic, he has spent time in the operation theater and he's giving us his valuable time. So, the oblique wires are clamped and the tension provided in the frame is elastic. You can see that this assembly produces a dynamic fracture compression and the constant elastic force of the clamp works in the arch and keystone principle. As Mario had just told us, this red rock is the keystone that keeps the arch in the place. Instant you remove this, the whole arch is going to fall. So in all arches, the keystone is a strength, and Leonardo da Vinci has said that an arch is a strength arising out of two weaknesses. You can see that though light in weight, bone is an extremely strong structure, and fall from a height seldom break a shaft of tibia or shaft of femur. It breaks the spine or the calcaneum, the cancellous bone. Just like an egg, the bone is very strong in vertical compression, but very weak in side-to-side compression. An arch is a joining of two weaknesses, and that is a keystone which is responsible for the strength. Even in a femoral fracture, a lot of trochanteric fractures fail because from the lateral side, it is little difficult to restore the keystone. If there was a way to reposition the keystone, these fractures will not fail. These keystones differ from proximal metaphyseal areas and distal metaphyseal areas to conical arches or round arches. The two types of arches, round and pointed. Proximal humerus and femur act like round arches, while elbow and knee behave like pointed arches. The round arch and pointed arch with keystone restoration is the concept of Mario, which has been used in the MIROS philosophy. MIROS is indicated in a wide variety of situations. Though it's a revolutionary concept because it's a bridge between external and internal fixations, but it has its own limitations and cannot be used in all fractures. It is more suitable for cancellous areas, metaphysio epiphyseal areas, and osteoporotic bones, where plates, external fixators, and screws perform rather very poorly. MIROS is a developing system, and the indications are being expanded over the last 12-15 years. Work is happening on elbow fractures, diaphyseal and clavicular fractures, and calcaneal fractures, metacarpal fractures, phalangeal fractures, wrist fractures, elbow fractures, proximal humeral fractures, ankle and calcaneal injuries, fractures around the knee, and fractures around the hip. The device is eminently suitable both as a retro and metro solution. TPTS clamps with the MIROS philosophy is being used by 34 surgeons in India presently. The subject and topic of 7 theses in India. 2 of them from this very institution are the first in the state of Andhra Pradesh to be using TPTS MIROS system. However, the beginner is cautioned to be selective while starting his work and beginning with simpler issues to gain confidence and proceed cautiously. Special thanks to Professor Atmaram and his team for this wonderful event, and very special thanks to Mario Tangari for being with us and helping us for this talk. Thanks, Mario. Now you have another 3 minutes to conclude the philosophy. Over to Mario.
Allora, io ringrazio tantissimo, moltissimo il professor Atmaram per avermi invitato in questo congresso. Ringrazio il professor Prakash che mi ha contattato e vuole portare in India la mia filosofia. Per me è un sogno, perché io ho trattato moltissimi pazienti e ho avuto un approccio ai pazienti con una tecnica mini-invasiva per aiutare la gente. Adesso il sogno si sta realizzando perché ho visto interesse da parte della comunità scientifica indiana del mio sistema e della mia filosofia. Vi ringrazio tantissimo, ringrazio i colleghi, ringrazio tutte le persone che stanno facendo realizzare il mio sogno in India, che è un paese che merita di avere una filosofia di questo genere, perché la popolazione è tanta, molta della popolazione è povera ed è necessario che questi strumenti possano essere diffusi col minor rischio, minor utilizzazione di sala operatoria.
Grazie. Mario says, thank you, Dr. Atmaram, for giving me this wonderful opportunity to present my philosophy before you people. Let me re-emphasize that it is not the clamps or the wires that are important. The philosophy of the arches and understanding the biomechanics of the bone to realign the forces in such a manner that the fracture integrates properly and unites. Unless you understand and follow the principles correctly, you will not get good results. And in orthopedics, we have to be gardeners and not carpenters. You have to look at the bone as a living structure and follow the biological forces of the bone to ensure that healing is perfect. Okay, Mario, continue.
Grazie a tutti. Arrivederci.
Thank you very much. And thank you, Professor Mario, for the lovely talk. Thank you.